If you're an IEN preparing for your Inspire Global Assessment, more specifically the SLA, nursing documentation is one of the crucial skills that you will be tested on during your assessment. But also once you are working in Canada as a nurse, nursing documentation is a universal skill that you will be using throughout your nursing journey. And it doesn't matter if you're working in the hospital, in community, in public health, in mental health, nursing documentation is something that you will be doing over and over. First, let's talk about the reason why is this important for nurses to learn? Why is this something that we should keep practicing and enhance our skill on? The first reason would be patient safety. If we are documenting and charting in a timely manner and properly, that will ensure the continuity of patient care. So what does that mean? When I am doing my 12-hour shift, if I documented properly, that means the oncoming nurse will be able to read my documentation, will be able to chart, and I don't have to call the night shift nurse and ask her what happened with today's patient, what happened to the shift today. Also, documentation will prevent medication errors. So the next reason would be legal protection. If you documented timely, if you documented properly, if something happens to this patient, unfortunately, there's situations where a patient dies, right? But if you charted properly and in a timely manner, and you documented everything you need to document, that will protect your license. That will protect you from going to court or from even getting sued. And next one would be professional responsibility. It is our responsibility to document properly and in a timely manner, to be able to communicate and pass on the patient's care to the oncoming healthcare professionals. SOAP is a structured method that is not only used by nurses, by physicians, but all healthcare professionals. So what does SOAP stands for? It stands for subjective data, objective data, assessment, and plan of action. So subjective is what the patient says. The patient says. So what are some examples of that? It can be how the patient is feeling. So if they're feeling pain, if they feel dizzy, if they feel lightheaded, for example, those are some subjective information, subjective data that you can use. Next would be objective. So this is based on your assessment. So this is something that you have observed and measure. What you measure, so it can be vital signs, for example, vital signs. Next would be assessment, and this is your clinical judgment based on subjective data and objective data you have gathered. Clinical judgment based on S&O of the SOAP. Next one would be the plan of action. So this would be the nursing interventions. So these are the things that you have done for your patient when the patient was complaining of dizziness or lightheadedness, or a patient is complaining of pain. Now let's do an example of how to use SOAP in a documentation or a patient case scenario. Here's an example scenario that you might be given during your Inspire Global Assessment SLA or NCAS, and how you can use SOAP to document what's happening. Mr. Johnson is complaining of chest pain. Now we're going to use SOAP to document what happened. First is S, subjective. Patient reports chest pain, rated 7 out of 10, worsened with movement. States, I feel tightness in my chest. Denies nausea and vomiting. When you are doing the subjective portion of your SOAP, ensure you are charting specifically word per word what the patient said, and use quotation marks. So in this example, I feel tightness in my chest. Sometimes they'll say, I feel as if there's an elephant sitting on my chest. And that is something that you would chart for your subjective data. Next would be objective. So what have you gathered? In vital signs, BP 140/90, heart rate 98 and regular, respiration 22, SpO2 96% on room air, or if you gave the patient oxygen, then you would say 96% on 2 liters via nasal prong or via NP. Skin warm and dry, no diaphoresis, ECG results pending, or you can just say ECG pending. Next would be your assessment. Patient exhibiting possible signs of angina, no signs of acute distress, requires further evaluation. What's your clinical judgment based on the subjective information and the objective information? And that would be your assessment. Next would be your plan. What have you done in terms of nursing intervention? Nitroglycerin 0.4 milligrams, sublingual administered as per order. If you also gave morphine, you can also chart that. Morphine given as per order. And just write the dose as well. Dr. Chu notified. I also like charting the doctor's name instead of just saying physician notified. But you can chart physician notified, or you can specifically say the doctor's name. So doctor's last name will suffice. So Dr. Chu notified. Patient closely monitored for response of based on the interventions you gave, right? We are closely monitoring the patient, so you would chart that. Patient educated for close monitoring. So that means you have told the patient that we will closely monitor you every 10 minutes, every 15 minutes, every half an hour. We'll do your blood pressure once it's more stable every hour. And you would also chart and notify nurse for other symptoms. So that means you have educated the patient to let you know if there's any other symptoms to call you when it happens. Properly and efficiently documenting during your Inspire Global Assessment SLA, and once you're working as a nurse, will show that you are using critical thinking, as you are able to collect relevant information, analyze it, and use your clinical judgment when you are providing nursing intervention. And using SOAP will demonstrate that. Also, using SOAP documentation or SOAP technique will ensure clear communication, and it can help prevent medical errors, it can help prevent legal issues, and it will protect you as a nurse. Trust me, when I was working as a forensic nurse examiner, one of our core responsibility is documenting. As a forensic nurse examiner, most of the patient's charts goes to court. So ensuring that we are documenting properly, efficiently, and timely is very important, as it will protect your license. Here are additional tips for your nursing documentation. Be objective and concise. Don't blabber too much when you are documentation. Just be clear, straight to the point when you are documenting. Don't use any abbreviations that aren't used in Canada. So before your SLA, before your assessment, ensure that you are familiarizing yourself with Canadian healthcare approved abbreviations. Next, write legibly and professionally. Don't use any slang words, and ensure that your writing is something that can be understood by all healthcare professionals. So write legibly. Next, timestamp your entries. Every time you're charting, ensure that you are writing the date and also the time. Don't forget that. Also, something that I've learned when I was a nursing student that my professor always kept telling me, if it's not documented, it didn't happen. So let's say you gave something happened to this patient, maybe a code blue, and you said, I check on this patient, I check the patient's vital signs, but you didn't chart it. So if it's not documented, it didn't happen. It doesn't matter what you say, doesn't matter what you did. If it's not on the patient's chart, it never happened. So ensure you document properly, timely, and in a very concise manner. And that's it for our video for today on nursing documentation. I hope you guys found that helpful. Don't forget to subscribe so you will get notified once I post more videos. And I will see you guys in the next video.
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.